Everything you need to know about enlarged prostate, BPH, signs and symptoms. Enlarged prostate, BPH, signs and symptoms can be both uncomfortable and disruptive to your life. It is important to know what signs and symptoms of an enlarged prostate may look like and how to best manage them. In this video, we will discuss everything you need to know about enlarged prostate, BPH, signs and symptoms, from how to recognize them to the different treatment options available. What is an enlarged prostate? An enlarged prostate, also known as benign prostatic hyperplasia or BPH, is a common condition in men over the age of 50. It occurs when the prostate, a small gland located just below the bladder, becomes swollen and enlarged. This can cause urinary problems, including difficulty urinating, increased frequency and urgency, and a weak stream. It is important to note that an enlarged prostate is not cancerous and does not increase the risk of prostate cancer. The prostate gland typically grows in size throughout a man's life and can begin to cause urinary problems as he ages. There are two main types of enlarged prostates, obstructive and non-obstructive. Obstructive BPH is caused by a blockage of the urethra due to an enlarged prostate, which makes it difficult for urine to pass through. Non-obstructive BPH does not have a blockage but can still cause uncomfortable symptoms. In some cases, an enlarged prostate can be managed with lifestyle changes or medications. In more severe cases, surgery may be necessary to remove the enlarged prostate tissue. No matter the cause or treatment plan, it is important to speak with your doctor if you experience any urinary problems, as they could be related to an enlarged prostate. Causes. The cause of an enlarged prostate is not fully understood, but it is believed to be due to hormonal changes that occur as men age. As men reach the age of 40, their bodies produce higher levels of the hormone dihydrotestosterone, DHT, which can lead to enlargement of the prostate gland. Other potential causes include inflammation and infection of the prostate and genetics. Age is one of the most common causes of an enlarged prostate. This is because testosterone, a male hormone, begins to decrease with age, while another hormone called dihydrotestosterone, DHT, increases. DHT can cause the prostate gland to grow larger. Inflammation and infection of the prostate can also cause an enlarged prostate. This can be caused by a number of different bacterial or viral infections. Prostatitis, for example, is an infection of the prostate that can lead to inflammation and enlargement of the gland. Genetics can also play a role in an enlarged prostate. Men whose father or brothers had an enlarged prostate are more likely to develop one themselves. Additionally, certain genetic conditions, such as Cowden syndrome, can increase the risk of developing an enlarged prostate. Finally, obesity and high blood pressure have been linked to an increased risk of an enlarged prostate. These conditions put extra strain on the body's organs, including the prostate. Risk factors. Having an enlarged prostate can increase your risk of developing a number of other health issues, including urinary tract infections and bladder or kidney stones. Knowing the risk factors for this condition can help you take steps to prevent it. Age is a major risk factor for enlarged prostate, as it becomes more common with advancing age. It's estimated that by age 60, more than half of men have an enlarged prostate. By age 80, it's estimated that almost 90% of men have this condition. Family history is another important risk factor. If your father or brother has an enlarged prostate, your risk of developing the condition is significantly higher. This is thought to be due to a combination of genetic factors and shared lifestyle habits. Other risk factors include race. African American men have an increased risk, being overweight or obese, smoking cigarettes, drinking alcohol, and having certain medical conditions such as high blood pressure or diabetes. It's important to remember that even if you are at higher risk for an enlarged prostate, there are still steps you can take to reduce your chances of developing this condition. Maintaining a healthy weight, exercising regularly, and avoiding cigarettes and excessive alcohol can all help to lower your risk. Symptoms. An enlarged prostate, benign prostatic hyperplasia, or BPH, can cause a number of symptoms. The severity of these symptoms can vary, and they may appear suddenly or develop gradually. Common symptoms include difficulty urinating, including a weak or intermittent urinary stream, or a feeling that the bladder is not completely empty. A frequent urge to urinate, especially at night. Trouble starting a urine stream. Dribbling at the end of urination. Straining while urinating. Weak urine flow. Leaking or dribbling urine. Inability to completely empty the bladder. Pain or burning during urination. blood in the urine, urine retention, inability to urinate, urinary tract infections, bladder stones. If you are experiencing any of these symptoms, it is important to contact your doctor as soon as possible. They can provide an accurate diagnosis and recommend an appropriate treatment plan. Treatment. When it comes to treating an enlarged prostate, there are a number of different treatment options available. Some treatments are designed to reduce symptoms while others are intended to slow down the progression of the condition. The most common treatment option for an enlarged prostate is medications that can help reduce the size of the prostate or relax the muscles around it, relieving symptoms such as difficulty with urination. Alpha blockers, 5-alpha reductase inhibitors, and anticholinergics are all commonly prescribed medications for an enlarged prostate. In some cases, a combination of drugs may be used. Surgery is another treatment option for an enlarged prostate. Transurethral resection of the prostate, TURP, is a common procedure in which part of the prostate is removed through the urethra. It is an effective treatment for reducing urinary symptoms, however it does not reduce the risk of BPH-related complications, such as bladder stones or urinary tract infections. In some cases, minimally invasive therapies can be used to treat an enlarged prostate. These include microwave therapy, transurethral needle ablation, TUNA, and holmium laser enucleation, HOLEP. These treatments can help reduce urinary symptoms without the need for open surgery. Finally, lifestyle changes such as avoiding caffeine and alcohol and drinking plenty of fluids can also help relieve symptoms. Regular exercise, such as walking or cycling, can also help reduce urinary symptoms. If you are experiencing any of the signs or symptoms of an enlarged prostate, it is important to speak to your doctor about the best course of treatment for you. Prevention. When it comes to preventing an enlarged prostate, there are a few things you can do. Eating a healthy diet and exercising regularly can reduce the risk of developing BPH. Additionally, avoiding certain lifestyle choices can help you reduce the risk. For example, quitting smoking, avoiding large amounts of alcohol, and reducing your caffeine intake may be beneficial. It's also important to manage any existing health conditions like diabetes and high blood pressure, as they can increase your risk for developing BPH. Finally, if you're experiencing any symptoms of an enlarged prostate, it's important to see your doctor for a proper diagnosis and treatment plan. While there is no guaranteed way to prevent an enlarged prostate, these steps can help you lower your risk and live a healthier life.